Hello everyone, I am Fabian Correa and today I'm going to talk about cardiovascular risk reduction with Icosapent Ethyl for hypertriglyceridemia. In the first definition, ethyl icosapent is a highly purified ethyl ester of icosapent acid, lowers triglyceride levels.
My hope is that the trial results of REDUCE-IT will be viewed as practice-changing. Certainly, we saw large degrees of benefit across a variety of different endpoints, including a 20% risk reduction in cardiovascular death that was statistically significant. Also significant reductions in myocardial infarction, stroke, hospitalization for unstable angina, revascularization procedures. So the number of events prevented in terms of the population treated was really quite substantial. And therefore, I think physicians will view the results as practice-changing once they become familiar with the trial results. Now, whether the results apply to Icosapent ethyl, the prescription medication that we studied, or whether they would be generalized to other different sorts of triglyceride-lowering compounds or omega-3 fatty acids is a question that I'm commonly asked, and I think the results of the trial apply to the drug we studied, which was Icosapent ethyl, 2 grams twice a day, so a total of 4 grams a day of that highly purified icosapentaenoic acid. That's very different from studies, say, the ASCEND trial or the VITAL trial that also examined omega-3s at a lower dose, a gram a day, and mixed preparations of DHA and EPA, not a pure EPA at a high dose as we studied. So I don't think the results of our trial could be applied to those drugs, which in fact have been shown to be negative in terms of trials such as VITAL and ASCEND and meta-analyses of some of the older trials. So the results that we saw, which I think are quite impressive in terms of magnitude of benefit, really shouldn't be extrapolated to other compounds, either other prescription compounds that may lower triglycerides, such as the ones I mentioned, or fibrates or niacin, and certainly shouldn't be extrapolated to over-the-counter supplements, which are not closely regulated and have variable degrees of EPA and DHA and other substances and saturated fats and so on in them. So really the results should be applied to Icosapent ethyl. And this is a position as well that in the most recent update to the guidelines, the American Diabetes Association agreed with. That is, they gave a level A recommendation, their highest level of evidence, to use of Icosapent ethyl in primary and secondary prevention type patients with elevated triglycerides in the range I mentioned, 135 to 500, despite therapy with statins. So that's really the target population for Icosapent ethyl, and those ADA 2019 update guidelines said that the results really shouldn't be applied to supplements or niacin or fibrates. In fact, they say those different compounds shouldn't be used with statin therapy because there's no evidence supporting their use.
Importance in medicine. Patients with high triglyceride levels have a greater risk of suffering ischemic events. It is important to find more effective drugs that reduce morbidity and mortality and with fewer adverse effects.
Ischemic heart disease or coronary artery disease happens when one of the arteries that supplies the blood flow to the heart muscle is blocked. There's really 2 main types of ischemic heart disease. One is having an acute heart attack or an acute myocardial infarction, and that occurs when the blood flow to the heart is blocked off suddenly and you have an occluded artery. As an interventional cardiologist, that is really a big part of what I do. Now, whereas an ST elevation MI happens when the vessel is totally blocked, chronic ischemic heart disease is kind of the definition we give when people have vessels that aren't completely blocked but can still give you symptoms. If you're having chest pain and you come to the hospital, which you should do if you are having chest pain, and it looks like you're having a heart attack, our job is to take care of you as quickly and effectively as possible. For me, that's really probably the most exciting thing about what I do. It can happen at 2 in the morning, but you really feel like you're making a difference because you're really trying to save somebody's life when they're having a heart attack. So here at Tacoma General, we have a 24/7 cardiac catheterization laboratory. The same goes for Good Samaritan and Multicare Auburn Medical Center. You hear a lot about door to balloon time, which essentially means the time from when you hit the emergency room door to when we get that vessel open in the catheterization laboratory. So the nationwide goal is less than 90 minutes. We certainly strive for that. Our goal is to get it done in less than 60 minutes if possible. And again, the reason time is of the essence is because the longer that artery is blocked, the more likely you are to have permanent damage to your heart, and the more likely you are to have dangerous outcomes and potentially die. Our EMS works closely with us, and they can actually call a heart attack in the field before they even get to the hospital. It's called pre-hospital activation. So if they see someone at their home and they have an EKG that says they're having an ST elevation MI, our EMS providers will call the ER and get the ball rolling, so we're that much more prepared when the patient gets here. Really, one of the most important things in preventing cardiac disease or preventing a recurrence of cardiac disease is lifestyle. We're specialists. We treat the cardiovascular disease when it's established and when we know patients have cardiovascular disease. But it really begins with the primary care physician. They are integral in, one, identifying people who have heart disease or have symptoms of heart disease. That's how they get to us usually. And two is treating them for their other medical conditions that can lead to heart disease. I think all of us went into medicine to help people. We get a chance to do that every day, and that's, I think, makes it worthwhile.
Pros and cons. The risk of ischemic events, including myocardial death, was significantly lower among patients with received 2 grams of ethyl Icosapent twice daily.
Elevated triglycerides are an independent marker of increased ischemic risk. Icosapent ethyl, a highly purified and stable EPA ethyl ester derived from fish oil, lowers triglyceride levels. However, it's not known whether it reduces ischemic events. In this multi-center randomized double-blind placebo-controlled trial, 8,179 statin-treated adults with persistently elevated triglycerides and established cardiovascular disease or diabetes and at least one additional cardiovascular risk factor were randomized to 2 grams of Icosapent ethyl twice daily or to placebo. The primary outcome was a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, or unstable angina. The key secondary outcome was a composite of cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke. After a median follow-up of 4.9 years, the primary outcome occurred in significantly fewer patients in the Icosapent ethyl group than in the placebo group. The key secondary outcome also occurred in significantly fewer patients in the Icosapent ethyl group than in the placebo group. Hospitalization for atrial fibrillation and flutter was more common with Icosapent ethyl. Serious bleeding was slightly but not significantly more frequent in the Icosapent ethyl group. The authors conclude that in patients with elevated triglycerides despite statin therapy, Icosapent ethyl significantly reduces the risk of ischemic events. Full trial results are available at nejm.org.
Cons. More data and studies are needed to determine its therapeutic windows and control adverse effects such as severe bleeding from the central nervous system and gastrointestinal.
Nearly every 40 seconds, someone in the U.S. suffers a heart attack. Now, one of the newest means of trying to prevent one is actually a drug that's been used for another health purpose. Eyewitness News Health Beat reporter Mark Hiller is here to explain. Mark?
Nick, the drug was previously prescribed for people suffering from high triglyceride levels, but the Food and Drug Administration believes it can reduce cardiovascular risk. I spoke to a local cardiologist about who best benefits from it and why it's not a good fit for everyone. This pill is a fish oil-derived medication called Vascepa. It's been around since 2012 to treat patients with high triglycerides, a type of fat found in the blood. But now the FDA has approved it for another purpose.
It was noticed that there was a significantly lower chances of death, heart attack, or strokes.
How significant? More than 8,000 high-risk cardiovascular patients took part in 5 years of randomized testing. Participants were already taking a statin to control elevated levels of triglycerides. Those who also took Vascepa during the testing period had a 25% lower risk of a cardiovascular event and a 20% lower risk of death. Dr. Khalil says don't confuse Vascepa with your average over-the-counter fish oil supplement.
Vascepa is a purified form of omega-3 fatty acid.
So that's why you need a prescription.
Exactly.
Dr. Khalil says 2 groups of patients benefit the most from Vascepa, including those 45 and older who previously had a heart attack or stroke, have high triglycerides, and are already on a statin. The other group, those 55 and older with diabetes and an extra risk factor.
Either they were a smoker, they had high blood pressure, or they had what we call peripheral vascular disease, blockages in the big arteries of the neck, the lower extremities.
Dr. Khalil says there's a rather insignificant risk of bleeding, irregular heartbeat, and body aches that may be associated with Vascepa. But for what the drug is now intended to do, he considers it the biggest development since statins.
And it's a game changer. It's for us clinicians.
Vascepa is taken twice a day along with a statin. The drug costs about $300 a month, but some co-pays are as low as $30. Keep in mind, if you take Vascepa, don't take other supplements without first consulting a doctor. With the Health Beat, Mark Hiller, Eyewitness News.
Is to apply in Ecuador. The rate of cardiovascular events and disease are widespread in our community.
Hi, I'm Jay Schuberg, a professor in the primary care department and a primary care diabetologist at Touro University, California, in Vallejo, California, in the United States. So we know that most people with type 2 diabetes die from cardiovascular disease, and despite having a plethora of treatments, statins, aspirin, agents that reduce cardiovascular risk, we still know that many of these patients, up to half of them, still have an unsuspected cardiovascular event beyond the risk reduction that we have found. And so there is still a need to find a way to reduce people's risk of the #1 cause of death from type 2 diabetes. So in the Reduce It trial that was presented this year at the 2020 American Diabetes Association Scientific Sessions, the Reduce It trial was looking at a subset of people with diabetes. And they were looking at the value of adding Icosapent to ongoing evidence-based treatment, including statins, and looking at expanded MACE outcomes. What they found was that actually the addition of Icosapent reduced both primary and secondary outcomes in these patients with type 2 diabetes and cardiovascular risk. Now, why this is important is that now we know that we have another agent to add to our armamentarium to reduce the #1 cause of death. And it is worthwhile to take the time to reduce triglycerides after you maximally provide benefit from a high or moderately high intensity statin. So this is an important addition as we look at the science of preventing cardiovascular risk. I know that many patients feel overwhelmed with the number of medicines they have to take, but in our patients who continue to have high triglycerides despite evidence-based treatment, it is a good option for us to consider. So I do think it's important that when we think about this study as it relates to our patients, that this year's presentation was related to a subgroup analysis of the larger Reduce It trial. The larger REDUCE-IT trial was published in the New England Journal of Medicine last year, and this subgroup analysis was not really powered for this outcome. Now, saying so, it still had a clinically significant outcome. So it is important to know that the study was not designed specifically for diabetes, and it is important with all medications that there are risks and benefits to the treatment. So most importantly, make sure your patient's not at risk for pancreatitis, and there was a higher risk in bleeding in those people who took Icosapent Ethyl. And so if your patient's at bleeding risk, you really would have to balance the risk and benefit profile for that patient. So I think as we look at the evolution of the treatment of diabetes, this is another treatment to add to our armamentarium. I think the next thing is to actually look at real-world studies and look and see how well do these get implemented. This is a twice-a-day medication. People with diabetes already have many medications they have to take, and the real-world studies will really tell us under common use, not under study use, does it provide the same benefit as it does in a randomized controlled trial. I really would look to see if they can repeat that in a real-world study.
Conclusions. When the studies are concluded and all study phases have been completed with an adequate sample, it is used in emergency and intensive care will show promise. Thank you everyone.